I have an online support group for chondrosarcoma patients. And the day I was able to create that is the day I went, this is what I went through it all for. Because I went through it alone. I felt so alone. I felt like there was no one else who had chondrosarcoma. The doctor told me I'd never meet another person with it. It was that rare. I felt like I didn't have to go through that alone anymore, that there were going to be others that I could communicate with. Each time that a person is in the group and they discuss their surgeries or what they're going through, and another person writes back some very wonderful comment to them that's supportive and loving, that heals that part of me that went through all that, that never heard those things. When someone says, I'm praying for you, or I'm thinking of you, I'm keeping in my thoughts, and I think, oh, that part of me is healing. It feels like I'm healed too, along with everyone else. I would have to say I have late effects from the damage to my musculoskeletal system. The fact that it's not stable, that it's constantly going out of whack. Today I came in here with a cane. 3 days ago I was using my walker. There are times when I know I have to use the wheelchair, that I just can't get around. And there are times when I've had to use the wheelchair for months at a time while I go through physical therapy and treatments to get myself back up and walking. I have to think every step I take. Every step I take has to be thought of. And now it's pretty much natural to me. I just watch and beware and that sort of thing. But in the beginning, in the first few years, I was constantly falling, slipping. If I could slip, there's no muscle on the inside of my leg to hold it together, so I would do a split and re-injure myself repeatedly. Pain issues are chronic. I've been on all kinds of pain meds as the years have gone by, and I've also learned how to do without them. And I prefer to do without them because when I take pain meds, I get like a foggy brain, and that's not worth it. It's not worth it. But there are times when I've just had to be on medications. Emotionally, this affects me also because of the drugs affect me emotionally in a very negative way. So it's important for me to be off of it. I've taken self-hypnosis classes. I've learned how to meditate. I've read every self-help book that ever came out for other problems and I would incorporate them into my life. I would take classes on relaxation and body awareness, and always, like, I joined Jack LaLanne's and worked out all the time, strengthening my muscles as much as I could, and then have to learn my limitations. And what's real frustrating for me is that people who don't know my whole history don't understand why I can do certain things, and then the next minute, that's it. I have to sit, or I have to go home, lie down for 3 days if I've overdone it. And that's one of the things. I will push myself, unfortunately, to overdo, and then I pay for it with 3 days in bed if I'm not on medications. My name is Elizabeth Moonrose, and I have survived 37 years beyond my first diagnosis of chondrosarcoma.